Next, we have Representative Felix, 5868. Okay, throw that away.
Well, hello. It's been a
Welcome.
long night. Thank you. But I'll be brief. Testifying in support of my legislation, HB 5868, and also in support of Rep. Morales' bill 5350, starting with mine. So thank you for your time and patience for staying here so long. So under this bill, registered nurses in Rhode Island would be allowed to perform non-surgical cosmetic, aesthetic, dermatological procedures, that's a mouthful, under the orders of a duly authorized prescriber. And it's done in accordance with the rules and regulations promulgated by the Board of Nursing if they have the necessary knowledge, skills, competency, as well as the training and education to perform those procedures. And for those who may not know, cosmetic and aesthetic medicine is an extension of the field of plastic surgery with an advent of non-invasive and minimally invasive, non-reconstructive, non-surgical procedures that can be administered by appropriately trained healthcare professionals within the private settings. These procedures help patients improve everything from their skin, their hair, their nails, again, for cosmetic purposes, not for health, usually not for health reasons. And this would expand, so this bill would expand the scope and practice of registered nurses in the state, potentially increasing the access for these types of procedures for patients who may not be able to receive them otherwise. The bill also outlines the documentation and informed consent requirements that nurses would need to follow when performing these procedures, and it would emphasize the importance of education, competency evaluation, safety measures for nurses who do perform these procedures, which can really help ensure that patients receive quality care and avoid potential complications. I should note that this is a similar bill modeled after other states that have actually expanded the services that registered nurses have been able to provide, and this includes Massachusetts, Arizona, Washington State, California, and many others. And so overall, this bill has the potential to benefit both patients and healthcare providers in Rhode Island, and I urge your consideration in passing this bill.
Thank you. Any questions for Representative Felix? Thank you, Representative.
Thank you. And then if I may, just in regards to Rep. Morales' bill,
Yes.
House Bill 5350, as a co-chair of the Black, Latino, Indigenous, Asian American, and Pacific Islander Caucus, it is a mouthful, but we can call it RIBLIA. We are in strong support of this legislation, and we actually included it as part of our legislative priorities, which will be coming out soon. And I just urge the committee to also give this bill the due consideration that it deserves, because it will really help our communities in terms of lowering the cost for medications and really help them stay more healthy as they deserve. So thank you so much.
Thank you, Representative.